Welcome to another session on Ask Me Anything related to breastfeeding. Myself, Dr. Tanima Singhal from Maa-Si Care Clinic, and I am here to answer all your questions related to breastfeeding. So, some of the questions have come on our regular Google Forms, which you all mothers have filled. So, first, I will answer all the questions which have come on through the Google Forms, which you all have filled, and then I'll take the questions which are there in the Q&A box live. So whatever are your questions, you can write in the Q&A box. And first I'll start with the questions which have already come to me, and then I'll take the questions in the Q&A box. So first question is from Taba. My baby doesn't suck my breast. I have to pump out and give through bottle. Please help me to breastfeed my daughter from my breast. So first of all, Taba, I don't know what is the age of your child. If your baby is less than 3 months, there is a very good chances that your baby can come on the breast. If the baby is more than 3 months, then you have to work on removing all the distractions around the baby, and also you have to work around the base, because the babies get the habit of the bottle. They understand the flow and all that. So you have to work on improving the flow of the breast and also by improving the supply. So now if your milk supply is very good and you are always pumping and giving your child, then definitely you can work on improving the direct breastfeeding. And that is by every time whenever you give the baby the bottle, you first give half of the amount and then take the baby back to the breast. Once the baby, like, you have to do this for every feeding session. So what will happen after some days, the baby might start coming on the breast for few seconds, but that's fine. If the baby starts coming on the breast, even for few seconds, it is always worth trying every time. So keep moving with that. And once the baby starts staying on the breast for a longer time, then you can start reducing the milk in the bottle in the first session which you have given. So this way your baby will start coming on the breast regularly, and this way you can bring your baby from the bottle towards your breast. Next question is from Pinky. How to increase evening milk supply? My baby is 2.5 months old and doesn't sleep for a long time. So Pinky, as you mentioned, your baby is 2.5 months old. So the pre-growth spot changes are being seen in the baby. That's why the baby is asking for cluster feedings. And specifically, feeling low milk supply during evenings is very normal. It is basically not the low milk supply. It is basically the babies are doing cluster feedings in the evening. So it is not that the baby is not getting enough milk. So what you have to do, the only indication of giving any top up is if the baby comes on the breast, suckles the breast and cries. If this is happening, then only you have to give any top up milk. But if the baby is ready to suckle on the breast during the evenings, that means the milk supply is not less. It is basically the cluster feeding which the baby is doing. So that way you can work on it. Third thing, if you are still feeling that, oh, my baby is crying on the breast and I have to give the milk from above. So in that case, what you can do, whenever the baby sleeps in the mornings and whenever you get little more time, that time start pumping or expressing the milk. And even after every feeding session of the baby, you can pump and express the milk. This will give an extra demand to your brain and the milk supply will increase. Next question is from Junjun. My baby is gaining only half kg in a month. Does it mean I have low milk supply? So 500 grams in a month, if your baby is 4 months or 5 months, it is absolutely correct. Now, because I don't know what is the age of your child, that's why I can't comment on this. But if your baby is 5 months and above, then perfectly fine. Next question is from Mercy. Does mother's age play a role in breastfeeding? As my age is 40, can I produce sufficient milk to my kid? Yes, definitely, Mercy, you can produce sufficient milk to your baby. And age doesn't have any any kind of connection that you can't produce enough breast milk. Next question is from Divya. My baby continuously wants nipple inside his mouth, otherwise won't sleep at all. This is not a good habit, Divya. If your baby has got habitual to nipple feeding, then first of all, you have to make sure that the baby is doing active feeding or passive feeding. Active feeding can be seen once the baby, you can see the gulping movement in the neck. When the baby is suckling and you can see the gulping movement on the breast, that means the baby is, the gulping movement in the neck of the baby. If you can see that, that means the baby is drinking milk. If the baby is not gulping, that means baby is doing passive feeding. So if your baby has a habit of doing passive feeding on the breast, then you have to be a little firm and just see that you remove this habit of nipple feeding on the breast and sleeping. Next question is from Latika. Low milk supply. So Latika, this is a very generic question which you have asked, low milk supply, because I don't know what is the age of your baby, like what all things you are having, those kind of difficulties. So if I talk about general indications on low milk supply, then obviously your hydration, the milk flow, third galactogogues, the medicines which I recommend is lactomagic powder and moringa tablets, and some allopathic tablets if the baby's formula milk is more than 4 times per day. So in that case, the allopathic tablets have to be prescribed, but that is always under the guidance of a doctor. Never self-medication should never be started for allopathy. And also skin to skin with your baby and checking the weight gain of the baby so that you know what is the progress of your efforts. Next question is from Himashri. Baby is around a month and she is not at all latching and milk supply is also less. So Himashri, first of all, you have to work on improving the milk supply, and the baby is just 1 month old. So you have to side by side work on the latching also. Now, if you have to improve the milk supply, then just as I told you, hydration, flow, medicines, skin to skin, and checking the weight. These are the important factors we have to work on improving the milk supply. And for latching is that every time when your baby demands milk, you first try to put the baby on the breast. If the baby cries, then you give katori feeding because your baby is just 1 month old. So give by palada or by katori. Don't introduce bottle right now. So in this way, and give half of the amount which the baby usually takes, and then try on the breast again. If the baby still cries, then you give the remaining amount in the palada, which is remaining. So this way, this you have to try every time. And once the baby cries, and then like you have to try every time. First initially and then mid katori feeding. If the baby is still not coming on the breast, then you have to express the milk. So this way, demand and supply will increase, and the other supporting factors will be there for the body. And this way, the milk supply will increase. Next question is from Reema. I have a 50 days old baby boy and I am suffering from low milk supply. What can I do? Reema, I just answered about this, how to improve the milk supply. Please follow that. So the milk supply will start increasing. Next question is from Shift. My breast never leak milk. Does that mean less milk supply? No. Shift, you have to understand that leaking of breast or heaviness of breast or fullness of breast doesn't mean that you have oversupply of milk or very good supply of milk. Basically, the leaking of breast, heaviness or fullness is only because of a active oxytocin reflex. Now, when we talk about an active oxytocin reflex, it is common first 6 weeks of the after delivery. Some mothers don't have that kind of reflex. Some mothers have it even after 6 weeks also, and some have it only for 6 weeks. So this is a very vague indication that the fullness, heaviness or leaking does not say that you have, does not mean that you have very good milk supply, or if there is no leaking, that doesn't mean that you don't have enough milk supply. Next question is from Lenny. How do I know my breast milk is sufficient for my baby? So that way you have to see your baby's weight gain. So if your baby is less than 3 months, the baby should gain 200 grams per week. If your baby is between 3 to 5 months, baby should gain 100 to 150 grams per week. More than 5 months, the baby should gain 100 grams per week. And if the baby is more than 6 months, it will be still less because solids have been introduced. So if your baby is gaining the same amount as I just indicated, and the baby is on exclusive breastfeeding, that means you are producing enough amount of milk. Next question is from Manasa. How to increase milk supply? So Manasa, I just answered about this, how to increase the milk supply. Next question is from Jyoti. If babies are bottle fed for 2 months, will they breastfeed from 3rd month? Yes, they can. So it will depend. If your milk supply is very good, then definitely you can try to get the babies on the breast. I have just told you about the tips and tricks of how you can try to get the baby from bottle towards the breast. Next question is from N.A. Boina. Low milk supply. I just answered about this N.A. about how to increase the milk supply. Next question is from Ashwini. Low breast milk and latching issue. So for low breast milk, I have already answered. For latching issues, so if you are having any kind of latching issues, cross cradle hold is a very good position which you can try it. And cross cradle hold is very good for latching if the mother is having any kind of latching issues, like painful nipples and even bleeding nipples and cut nipples, sore nipples. So cross cradle hold is a very good hold for having good latching. And yes, the mid bottle feeding or the mid palada feeding is very good. If your baby is less than 6 weeks, so please try to remove the bottle and try to feed the baby with palada or by katori. And if your baby is more than 6 weeks and the baby has got a very bad habit of bottle, then always try for mid bottle feeding, which I have just answered at the mid, like when I started this session, today's session. Next question is from Mariam. Very low milk supply and my baby refusing breast milk. So Mariam, first of all, for low milk supply, I have answered about this. And if it is very low milk supply, then I would suggest that please don't waste time. If you have very low milk supply, please reach out to our team and get your appointment scheduled with our doctors so that they can help you and they can improve your breast milk supply. And what did you say? My baby refusing breast milk. So if the baby is even not accepting by the palada or by a bottle, that is a different concern. If the baby is accepting the express breast milk, that it is fine. At least start doing that and give express breast milk, and side by side work on improving your milk supply and also work on getting the baby back to the breast. Next question is from Sundari. If my baby drink milk from one breast completely and little from other breast, should I pump remaining from the other breast? Yes, definitely. Sundari, you have to express the milk from the other breast. Otherwise, the milk supply will go low on the other side where the baby is not completing the breast. And also, next session, you can feed the baby from the other side. So this way, you just keep alternating so that the milk supply is equally maintained. And also, Sundari, if the baby is gaining weight good and like your baby's weight gain is good and your baby is on exclusive breastfeeding, then you don't need to express the milk every time. Next question is from Archana. How to use lactomagic powder and moringa tablets? 3 months baby, weight 4.5 kg, 50% breastfeeding. Now latch is good, no medical issue. So Archana, first of all, for lactomagic powder, if you are trying to increase the breast milk supply, then it is 2 tablespoons 3 times a day. And for moringa tablet, 1 tablet 3 times a day. If you are working on maintaining the milk supply, then lactomagic is 2 scoops 2 times a day, and moringa tablet is 1 tablet twice a day. And along with that you have to work on your hydration. Have 3 liters of water every day. Second is skin to skin with the baby. Third is every time breastfeeding first, then give half of the amount of the formula or the express breast milk, and then bring the baby back to the breast. And if the baby is still not coming on the breast, then you have to pump. So this way, follow this pattern every time. The supply demand protocol is very important to improve the breast milk supply. Next question is from Chetan. My baby doesn't take bowl feeding. Please give me a suggestion. So if the baby is not accepting bowl feeding, then you can go for palada feeding. It is very helpful for the babies when we are trying to bring them from the bottle or from upper feeding from towards the breast. And also if the bowl feeding is not working, you can go for cup feeding also. So palada feeding and the cup feeding are very helpful if you are trying to remove the bottle feeding of the baby. So instead of bowl feeding, you can try for cup feeding and also with the palada feeding. Next question is from Saida Samreen. Why there is no milk supply after everything done to improve the supply? That is definitely there might be some medical issues. You might need to first find out whether your thyroid levels are all normal, any diabetic issues, any medical issues. If they are not like maintained, then it might cause a problem. But if your all medical issues are definitely in normal, like normal parameters, then it will not cause any problem about breastfeeding. Now coming on the part doing everything. Now first I need to understand what all things you are doing. Are you doing regularly massage and the compress? Are you doing regularly taking in enough amount of water? Are you enough taking the galactocogs as prescribed? Are you doing regularly KMC with your baby? Are you regularly checking the weight of your baby? Are you properly following the demand and supply protocols? So all these things also are important to understand when you are saying that I am doing everything. So everything counts. It is not about just a random thing. So it is basically, you have to understand breastfeeding is like a wheel. And all the pointers which we have to do are the different spikes of that wheel. If we are only doing 1 or 2 spikes, our wheel will not move. So we have to do all the spikes together, and all the spikes like in like we have to do all the spikes and we have to do them all together. So that way, when if you're doing all the spikes together, the wheel will start rotating. So that's why you have to understand that when we are telling about the protocols, each and every point has a very important and specific role. And many times mothers say that we are not getting enough time, we don't get enough time. Then girls, you have to understand what is your priority right now. If you have to work on breastfeeding, if you have to work on improving the breast milk supply, if you have to work on getting your child on the breast, then definitely you have to spend time. You just we can't help you if you're not able to find time for yourself in doing these things, because this is not like day one, like 1 or 2 days things. Your baby has come on formula feeding for last couple of months where you have been working on this and the baby went to the formula milk. Now when we are trying to revert that process, it will definitely take some time. It is not like 1 or 2 days thing that if you do it for 1 week, you will get results. It is not like that. You might see some results, but to have consistent results and to remove all the dependency on formula milk or any other milk, then definitely we need to make consistent efforts in one direction and get the results and get everything resolved. Next question is from Nisha. Sometimes I hardly get milk to breastfeed my baby. How to check that sufficient milk is produced to feed my baby? Now, many times what you do, you just press the breast and see if there is no milk coming, you just feel that there is no breast milk. Always remember, nature doesn't work like this. Milk is not always dripping from the breast that you just press and you will get like streams of breast milk like this. It doesn't work like that. If this starts happening, so imagine this will become so difficult for the mother to keep leaking the milk every time throughout the day. For first few weeks, it is fine. But if the mother has to breastfeed her baby for 2 years or 3 years, if she's always leaking, then how she will manage her life? So basically, nature has planned in a way that there is stimulation on the breast, there are small projections which you have seen around your nipple. So when the baby suckles on the breast, or when there is pumping, or when there are hand expressions, those projections get stimulated and they give the signal to the brain that baby is suckling and baby is wanting milk. And when that stimulation goes to the brain, then the let down reflex happens and the milk starts flowing. So when you're pressing the breast and seeing that, oh, no milk is coming, there is no milk, that doesn't work that way. You have to always put the baby on the breast and let the nature work on it. Many times you just feel that I don't have milk and you don't try itself. You have to put the baby on the breast and let the baby suckle for a few seconds or few minutes. Then the milk supply will start coming down. Now, many of you say that when I bring the baby to the breast, the baby starts crying. In that case, you just have to do massage on the breast and then manually press the breast and get the nipple, like the milk flowing in the nipples, and then put the baby on the breast. But this you have to do consistently on all feeding sessions. When you are doing it on all feeding sessions, maybe you are trying for 8 times, the baby starts coming for 2 times. But now if you are only trying 1 or 2 times, there are like many chances that the baby will not come on the breast. So you have to do consistent efforts regularly under the guidance of a doctor who will help you, who will guide you on every step. And that is the reason we have introduced our this one-on-one programs with the doctors. So right now, what are the programs when there is our consultations with our doctors, and our helpline team answers the mothers between daytime when the mothers have any questions. But we have all seen that the mothers need one step more efforts. They need some more support from the doctors themselves. And that's why we have got our regular now, we have brought new programs now where the patients are directly connected to their doctors. So they have their WhatsApp numbers of the doctors, their personal numbers, and they can message them any time in the day, and the doctor will, at their ease, will reply them. But obviously, these programs are different. They are not as the regular one-on-one programs which we are running right now. So if any one of you who is wanting to have a personal guidance with your doctor regularly and to be connected with them regularly, then you can reach out to the team and get involved for the direct sessions where you will be like connected to your doctor personally on personal levels with on their WhatsApp. Next question is from Smriti. She says, how to increase the supply? So I've already answered Smriti about this. Next question is from Ganga, low milk supply. Answered already, Ganga. Next question is from Deepika. I delivered premature baby of 32 weeks. My baby was in NICU. I have milk first 2 weeks, but now I don't have milk. So Deepika, your baby was born premature and the milk supply came in the initial days, but then the milk supply went down. So basically it is disruption of supply and demand like old protocol. So if the milk supply came in the initial days and then went down, then please Deepika, you can still increase the breast milk supply, but since your baby is a premature baby, so I would suggest you not to waste time further. Get on a consultation with the doctors and get a proper protocol made for you so that you can get the results and get your baby in a healthy situation. Next question is from Shiva. अगर बेबी डायरेक्ट ब्रेस्ट फीड ना करे तो फिर कितनी कितनी देर में पंपिंग करना चाहिए? बेबी इज 3.5 months ओल्ड. सो अगर बेबी डायरेक्टली ब्रेस्ट फीड नहीं कर रहा है तो बच्चा अगर फॉर्मूला मिल्क सपोज 8 बार लेता है तो आपको कम से कम 8 times ऑब्वियसली पंप करना पड़ेगा. अब धीरे धीरे करके जब आपका डिमांड एंड सप्लाई ठीक होता जाएगा और ब्रेस्ट मिल्क की सप्लाई अच्छी होती जाएगी, उसके बाद आपका एक बार बॉडी को समझ में आ जाएगी कि उसको कितना मिल्क बनाना है, उसके बाद आप अपने पंपिंग के सेशंस को कम कर सकते हैं. तो इस तरह से शिवा आपको अपनी पहले बॉडी को पहले वो स्टिमुलस देना है कि इतना मिल्क मुझे चाहिए मेरे बच्चे के लिए. एक बार जब इतना मिल्क प्रोड्यूस होने लग जाएगा फिर आप ब्रेस्ट फीडिंग के सेशंस को पंपिंग के सेशंस को कम कर सकते हैं, जिससे आपका मिल्क सप्लाई कम नहीं होगा और आपके बच्चे के लिए सफिशिएंट रहेगा. नेक्स्ट क्वेश्चन इज फ्रॉम आरटी. लैचिंग. सो लैचिंग के लिए मैंने अभी कई चीजें बताई हैं, बट अगर आप मुझे स्पेसिफिकली बताओगे कि आपको लैचिंग में क्या दिक्कत आ रही है तो मैं आपको बेटर तरीके से आंसर कर पाऊंगी. ऑल्दो लैचिंग के लिए मैंने आपको ऑलरेडी कई सारे इसमें चीजें बताई हैं. ये क्वेश्चंस आज के थे जो आप लोगों ने गूगल फॉर्म पे भरे थे. अब मैं वो क्वेश्चंस लेती हूँ जो इसमें लाइव आए हुए हैं. सबसे पहला क्वेश्चन है दीपा शर्मा. हाय, माय नेम इज दीपा शर्मा. Just wanted to tell you that I have inverted nipples. I can't breastfeed my child. So I am using breast pump. How much ml can be pumped within an hour? See, Deepa, first of all, understand that you are not a machine where you can just input that, okay, I need 400 ml and that much milk will come out. It is not working like that. It is a human body who has gone through a major change of giving a childbirth, who has delivered a baby recently and has given birth to a life. So please be gentle on your bodies. Don't try to push yourself to improve breast milk supply in a very small time. This is your body fluid. Come on, girls, you have to understand. Breast milk is produced from your body. Whatever you're eating, whatever you are having, that is being produced in the breast milk. Now, if you are trying to push yourself to improve the breast milk in a very short span of time, that will drain out the nutrition from your body. I understand as mothers, we want to give the best for our child, but always remember your health is a priority too. You have given birth to a child recently. So you have to always be tender on your body. You have to be gentle with your body. So when you talk about how much breast milk can I pump within an hour, so it is always like what is the demand. If your child demands 40 ml every hour, then we have to work in a way that we should have breast milk in like every 3 hourly, we should pump and try to produce at least 60 to 80 ml. Now, first of all, this is also important that it is not only about the quantity of breast milk. So when we work on improving the milk supply, we make sure that the quality of the breast milk also improves. And many times I have seen the mothers producing only 20 ml of milk, but that is equivalent to 60 to 80 ml of formula milk. Because, and how do we check? We check it by seeing the weight gain of the baby. So what we do, we ask the mother to see whatever amount of formula she has given in 1 week and whatever milk she has produced. In second week, what we do, we just reduce the small amount of formula milk and we keep moving. And if we see that weight is still improving, that means the formula milk is reducing and weight is increasing. Now just think one logic. Everyone, please focus here and listen to me. Just think about one thing. What is our final goal? Our final goal is that the formula milk should come down and baby's weight should increase. Correct? Do you all agree? Think about it again. Formula milk should come down, baby's weight should increase. All of you agree? Just give me a thumbs up in the chat box that you are like, just give me then the reaction with a like raise hand and you understand what I am telling you. If your baby's formula milk is decreasing and baby's weight is increasing, correct? This is all what we want. Now, how much milk is produced? Do we really need to worry about it? No. It is about how formula milk should go down and weight should increase. If this is happening, maybe the milk supply is only 20 ml. Maybe the milk supply is only 60 ml. So because every mother is different, every baby is different. So the composition of breast milk will also change. It is not your formula dabba which is produced in a factory. In one factory, if a dabba is produced, the same dabba will be going throughout the world. But a mother who is producing breast milk is very, very like tailor-made for her child. So if the baby's demand and the mother's milk production, this is different for every mother, every baby. So we have to see the universal guidelines of our weight increase. Now the weight, we know the universal guidelines of the baby's weight. So if our baby is increasing weight and the formula milk quantity is going down, that means we are on the correct path. Then why do you bang your head on improving milk supply, on how much milk supply I'm producing? Please don't worry about it. It is a simple concept of formula milk should go down and your baby's weight should increase. Got it? So if you're clear about this, then definitely you will not run after the amount of breast milk. Got it, girls? Hope I'm able to answer. I am able to make you understand. If you still have any questions, you can write in the Q&A box about this point which I just mentioned. Next question is from Deepika Gaurav. I delivered 32 weeks baby. He was in NICU. I have milk supply for 2 weeks, but now milk supply stopped. Please suggest what to do now. I think Deepika, I just answered your question. It was there in the this sheet also. You have you would have filled this question in the Google form also. I already answered, Deepika. If something more, then you can write in the Q&A box. Next question is from Deepti. My baby's age is 1 month, 10 days and start crying when he is coming to the breast. Okay. So Deepti, always understand if your baby is crying on the breast, that means the flow of the milk or the supply of the milk is, or the technique of breastfeeding is not correct. So you have to work on these 3 things. Improve the milk supply, improve the flow of the milk, work on the techniques of latching. Once these 3 things are on place, then definitely your baby will come on the breast. Your baby is just 1.5 months old. You can definitely get the baby back to the breast. Next question is from Shiftar. I underwent LSCS and get back pain when feeding in sitting position. Also have large breast. Which sitting position is the best? So first, if you have large breast and you are having pain, then first is the cross cradle hold and second is the football hold. These 2 holds are very good. And third, when I feed in lying down position, she goes to sleep in 15 minutes on one breast itself. So if the baby goes to sleep in 15 minutes on one breast and if the baby is gaining weight properly, then you don't have to worry about it, Shiftar. It is basically the amount of milk that the baby should take. If the baby has finished from the breast in 15 minutes, that's definitely a good sign for according to me. Next question is again from Shiftar. How to differentiate between fore milk and hind milk? After how long does breast get empty? Good question, Shiftar. So how to differentiate between fore milk and hind milk? It is by seeing the color of the milk. The fore milk will look more transparent and it will be looking more translucent. Hind milk will look thick, it will look pearly white. So this way you can differentiate between fore milk and hind milk. After how long does breast get empty? That is varying from mother to mother, from baby to baby, depending on how better a sucking of the baby is. This is not like universal that the breast, it is not like having miles per hour, that the baby should suckle the breast at this miles per hour or this speed. It is not like that. Every baby is different, every mother is different. And even if you talk about the full day, the hunger of the baby is also different. The production of the breast milk is also very different. See, our bodies are complex, but they are beautiful bodies. The nature has planned everything very well. It is basically the concepts which you have to understand And that you have to do always under an expert guidance who will just talk to you every time, who will make you understand the concepts. And it is not only about just following improving the breast milk. It is about learning about your child's nutrition. How is the everything working? And that will make you so like you will really appreciate about the nature. You will understand what like beautiful bodies God has created for us and what miracles your body can do. So never doubt yourself. It is basically a knowledge gap which most of the mothers are facing. And it is also because you people are confused. You are seeing so much of internet, you are seeing so much of social media, and you get so much of confusions with that. And moreover, you keep asking your fellow beings who also don't know what is best. So it is always an important thing to reach out to a expert lactation consultants, especially if they are doctors. That will be very good. Reason being because they understand the physiology of the body. And still, if you get whatever expert guidance you can just get, please go to them, but always see the experience of the mothers. I have seen many new lactation consultants coming up who have very small babies or maybe have breastfed just one baby, and then they understood that, oh, breast milk is good, breastfeeding is good, and they got interest towards it, and they started learning about breastfeeding, and they started consulting. So you have to always understand what is the experience of a lactation consultant, how many mothers they have or like dealt, and then you should take a proper informed decision. And when you get somebody who has really good experience, then please don't waste time in learning yourself and then doing things. It is always good that to learn under those guidance, and they will teach you in a better way how to things are moving. So this way you will be taking an informed decision for your baby. And also understand, as mothers, we are so conscious about what we are doing for our child. We want the softest clothes for our child. We want the best mattress for our child. We want the best skincare products for our baby. We want the safest things for our baby. But when we comes about what we are giving them intake, then we are relying on a formula which is like made in a factory. Come on, girls, you can do better. You can do really better. And what it takes just about knowledge, and it just takes about understanding, and it just needs to make you understand the concepts about breastfeeding. And I am not like saying that the baby mothers who are not producing enough milk are not doing good, but I can say this one thing, that you have a chance to learn. You can learn and you can practice it, and then you can just leave it to nature. If you are working your things out, you are doing everything in your possible whatever you're doing in your possible ways, and you can't do more than that, then be peace at it. Don't try to push yourself. Always remember, your best efforts are more important than when you are working about pushing yourself. You should feel good about it. After 5 years, after 10 years, when you think about this phase of breastfeeding, you should have a smile on your face. You should not have tears in your eye. Oh, that was a very difficult phase. It should not be that way. So always try to make your breastfeeding journey a memorable one. Don't push yourself too much. And if you are fully feeling too much pushy, talk to a doctor. Come on, girls. At least that much things you can do. Reach out to them, talk to them, and talk to them about your situation. That we are facing this kind of things. Is there any solution for that? And if they give you any solution, then give your 100% do on that, whatever they are telling you. So that way you can get best results and you will be at peace with yourself. Okay, so too much of Gyan today. So I hope your questions are over. And if you have any other questions or you want to like have a talk, because today I have finished my session, so I have 10 more minutes. You can raise your hand, I'll unmute you and you can talk to me one-on-one. So I'm waiting for 1 or 2 minutes. If anyone who wants to talk to me directly right now, just raise your hand and I'll unmute you. I'm not seeing any raising hands. I hope it is all clear to everyone. So Pinky has a question. Okay. Yes, Pinky, you can unmute yourself and have a talk.
Hi, ma'am. I hope you're doing well.
Yeah, I'm doing very well. You just tell me, how are you?
I'm good. I'm good. My baby is 2.5 months old. And on 9th of this month, I had checked his weight. His weight was 4,600. And he was born with a very low weight, which is 2,580.
Okay.
Now, what is happening is for the entire day, I feel that my breast milk is enough. But at evening time, it's been almost a month that I feel that even after feeding, my baby is not sleeping. So, sleep is the issue. But I have heard a lot about witching hour and about cluster feeding. So, I don't know what exactly my baby is doing because he takes power naps when he breastfeeds. And so he takes power naps of 20 minutes, 25 minutes. But again, after 20, 25 minutes, he wakes up, and this is
Okay.
every day in the evening. When I
Yeah.
see his white diapers, I recently have started giving him formula feed 60 ml just to see whether he's sleeping. He doesn't sleep even after taking 60 ml of outside milk and after my milk. So this
Okay.
is like from a long time I'm facing this issue. After 45 days of his birth, he's continuously doing like this. In the evening, he's not sleeping. At night now, since he's almost 2.5 months old, he's sleeping for 3 hours and wakes up in 3 hours. At that night, I feel that my breast gets little harder. Also in the morning it's harder, but in the evening I feel like it's quite soft enough. So I feel that since it's evening, that is not my milk supply is low. So I wanted to know what I should do for increasing my milk supply in evening.
Okay. So first of all, Pinky, this is not a problem. Okay. Your baby is doing cluster feeding in the evening, which is very common for babies less than 3.5 months. Now, how to resolve this? Now, how you will check if this low milk supply or not? If the baby is coming on the breast and staying on the breast, then it is definitely not a low milk supply. If the baby is crying on the breast, then definitely that means the baby breasts are empty or the baby is not having milk. So now first tell
What
me, is the baby suckling on the breast or
Yes,
crying
he
on the breast?
suckles, but he tries to pull off. When he tries to pull off, I see a lot of milk on his, dropping on his mouth. So what he does is he tries to pull off my breast. But whenever I check, I see that there is quite enough milk. Even I tried pumping once. I hardly produce 30 ml, but then I feel like if he suckles for more 5 10 minutes, that I'm able to produce more than 60 ml. I
Pinky,
feel
you're
like
definitely Pinky, you're definitely not having low breast milk supply. It is basically only this knowledge gap where you have to understand the babies doing cluster feeding is very normal. Okay, and they are doing it basically because they are that is a soothing time for the baby, and you have to understand one thing. This is nature. Nature will always try to keep up the breast milk supply. So this is nature's way of cluster feeding. Now you imagine when the cluster feeding is there, the baby is wanting the breast milk again and again. This gives a demand to the brain, and the brain supply makes the milk supply. Your baby is growing per day. So how will the brain understand that the milk production has to increase? So what will happen whenever you are putting the baby on the breast, definitely the demand is more and the breast milk supply will keep on increasing. After three
so
and a half
every day.
months,
So every day if he does that, is it fine?
yes, it is fine. You can just lie down during that time and you can feed the baby. Also, what you can do when your baby is taking bigger naps in the night and you are feeding better milk supply in the nights and in the early mornings, you can express the milk and keep it, store it. And in the evening, when it becomes too tiring, that time you can just supplement with the express breast milk which you're already having. And this is very clear because you have mentioned that I have given 60 ml of formula milk and tried. Still, the baby keeps on asking for milk. So basically, it is not about the low milk supply. It is about the cluster feeding, which is very
Sleep in
normal.
the evening. Actually, sleep only I used to do because when I spoke to the pediatrician, he said that if you try to give formula feed, he might sleep. I did everything to make him sleep in the evening. I tried him to put down to Jula and everything. I got Jula for him. But in the evening time, he was not sleeping, and I
See,
started with
Pinky, you
formula.
can't. It's just a small baby of 2.5 months. You just can't like right now clock him for that. And please don't do
Right.
that right now. Let him be whatever he wants. It's perfectly fine. What
So
you
when
can do,
he's
you
doing
can.
cluster feeding and
It's
asking for
fine.
feed for like it's fine.
It's
And how
fine.
much
It's
milk
fine.
should I keep? Like what I do, what I see in him is he's asking for feed. He sleeps. He doesn't do active feeding. He doesn't. He does passive feeding. So in
Yes.
20 25 minutes he goes off to sleep. When I again put him down, he again awakes and again starts asking for feed. In that
Correct.
matter, I'm not able to manage my household chores, and like
Correct.
I am right now. I have to cook, and there are so many other things. So, what is
So Pinky,
another
see
way
one
to
thing.
get?
one thing, what you can do now, you know that what is the pattern of my child. Usually it will be starting around 5:35, 5:30, and it will continue till 8, 8:30. So you can manage that time. Instead of pushing your child for putting the baby on the sleep, what you can know, when you know that if the baby will be doing this pattern for around 5, 5:30. So what you can
Ma'am,
do,
he
you
does
can
it at
put,
6 and it lasts till 11:30, 12 at night. It is for
that's too
continuous
long.
6 hours.
So that's too long. What you can do, like evening time, that's fine. But if the baby is like suckles more than 9 or after 9 p.m., then you can express the breast milk as I told you in the mornings. And that you can supplement in the evenings by katori or by palada. That way you can do Pinky.
Okay.
Okay.
Okay, ma'am. Yeah, thank you.
Welcome. So, okay, girls, now I'm not seeing any other raised hands. So, take care, everyone, and hope these sessions are helping you out. So, Smriti has to ask some question. Okay, Smriti, you can unmute. Yes, Smriti, you can unmute.
Hello, can you hear me?
Yes, 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 I can
Yeah,
hear you.
sorry. Actually, the baby is sleeping on my chest, so that's the reason I was not able to understand whether I unmute. So, basically, my baby is 1.5 month old, and I have similar, issue that my baby was not putting on weight. So, mother pediatrician asked us to continue doing the formula feed, which is the top feed, as well as breastfeed. But I was not able to understand whether I'm producing enough milk or not, so I started expressing it, and I express the milk, and I'm giving him 2 to 3 pump feeds, and in the course of the day I take him, like, for the breastfeeding, and we give him formula feeds as well. So I wanted to know that, if we stop the formula feed, if I want to, basically I want to stop formula feed and go exclusively on the breastfeed only, because that's what my intention is, because obviously the benefits which are there from the breastfeed, which is there. How do I know that, if my baby is getting enough milk when he's breastfeeding, and whether he sleeps or not? I mean, I really don't. I'm a little confused about my breast milk supply. It is definitely less when I pump also. Sometimes I get 60, sometimes I get 70, sometimes I get only 30 or 25. So it's not fixed how much supply I get, and it's any time of the day, at late night, early morning. I have tried pumping, and it varies at time to time.
So, Smriti, see, why did you start formula? Because your pediatricians saw less weight gain. So basically, you have
Yes,
to
yes.
understand weight gain is the most important factor. So when we are trying to get the baby on exclusive breastfeeding, then the attempts which we are doing on improving the milk supply, how do we know whether it is increasing or not? That is by checking the weight gain of the baby. So now, whenever
Okay.
you are feeding your baby, after that, when you see the hind milk still coming, then you can express that
Yeah.
milk and keep replacing it with the formula, and keep, like, you check the weight on day 1 and then check the weight on day 7. If your baby is just 1.5 months
Okay.
old, as you said, so baby should gain 200 grams in a
Yeah.
week. If your baby is gaining more than 200 grams,
Okay.
what you do, whatever amount of formula milk which you are giving, start reducing it slowly and keep working on this weekly. So what will happen, the formula milk will keep going
Okay.
down, and the weight, if you are seeing the weight gain is there, that will definitely increase your
Okay.
confidence, and you can keep moving around that.
Okay. Okay. So and in the course of the day, I mean, I take him on breastfeeding for sometime 15 minutes, 20, 25 minutes, 30 minutes, as well as I express milk. But I'm not able to get time to express milk enough, because the whole idea is I want to make sure that he gets the breast milk. And that's why I started expressing the milk.
So
So
now
should
always
I?
understand, if you are doing expression like there is no proper routine of expression. So your brain understand baby now. Okay. When you are
Okay.
doing
Okay.
something from outside, like pumping is an alien feeling for the brain. When you start pumping like without any proper rhythm, then your brain doesn't understand it, and it will not it will not release that amount of milk which is there in the breast. So first of
Okay.
all, if you are pumping and like doing in a AY way, it is like sometimes you are doing pumping 2 times, sometimes you are doing 3 times. Like if there is no proper pattern,
Okay.
your brain will not understand that stimulus, and it will not
Okay.
release the milk. So
Is
first
it a
of all,
particular
don't
time
worry.
that you're trying to suggest that, say in the morning at 8 o'clock if I express, or in the afternoon 12 o'clock if I express, I should stick to these time patterns and express my milk
No, I
at
will
that
not say
particular
like
time?
that. Right now, when your baby is like feeding also, so that will
Hmm.
not work for you. That works only
Okay.
for the mothers where they are like the babies are not coming on the breast, or when we are working
Okay.
on relactation. So fixed
Okay.
timings are working for them. For the
Okay.
mothers who are already breastfeeding their babies, so one thing what you have to do, every time you breastfeed your baby, and after that, if the baby cries, in that case, if you are giving something from outside, make sure that you are giving only half of the what amount you are giving. Suppose you are
Okay.
giving 60 ml. You first give
Okay.
30 ml, take the baby back to the breast. Okay.
Okay.
Now, after
Okay.
this, if the baby still cries, you give the 30 ml to the baby and you just pump out for 10 minutes. If your baby is satisfied of the second feed, then nothing to do. You can just hand express for 2 to 3 minutes to give that extra demand for your brain. That's all. So this
Okay.
works the best for the mothers who are already exclusively, like who are already breastfeeding the babies and trying to improve the breast milk supply.
Okay. Thank you so much, doctor.
Most welcome, dear. Harini. Harini, you can unmute.
Hello,
Yes.
madam, you can hear me?
Yes, I can hear you.
Okay, ma'am, my kid is 6 weeks old, and sometimes he sucks for 30 to 40 minutes and still he cries. And sometimes he doesn't even suck for 2 to 3 minutes also. So we immediately give him 60 ml of formula milk. And I feel my milk is very low because when I pump, sometimes I just get 5 to 10 ml and sometimes 30 ml and not more than that. I don't know what to do.
6 weeks is a growth spurt. So you have to understand the growth spurts. Growth spurts are 2 weeks, 6 weeks, 3 months, 5 months, 7 months. So at 6 weeks, babies have growth spurt. So their demand increases at this time. Now, as I just told to Spriti also, when you are pumping like without any pattern, then please don't worry about the pump output. Pump output will not give you the correct indicator of how much milk you are producing. So what you have to do, every time your baby demands milk, you first put the baby on the breast, and then if the baby cries, give half of the amount which you have been giving, and then take the baby again back to the breast. So this way, there will be two demands on the breast, and then if the baby is like now satisfied, then don't give the other remaining amount of milk which you have prepared for the baby. You just hand express and collect this milk. And if the baby is still crying, then you can give that amount of milk which is remaining to the baby, and your milk, that time you can pump for 10 minutes. So this pumping, when we are doing the second time, it is not for collecting the breast milk. It is basically to give the demand to the brain that we still need more milk for the brain. So you have to understand why we need to do pump. Mothers are doing unjudicial use of pumps. They pump out 10 ml, 20 ml, 30 ml, and they feel bad. Oh, I have so low milk supply. So pumping is not for the mothers who are already feeding their babies. If you are doing pumping, it is basically to improve the demand on the brain, to give it an extra demand that we need more milk. We are telling our kitchen that to make more. So I'll just explain it to you with an example. Suppose you are in the kitchen and making food for 4 people every day. Now, if your husband brought 2 more people to your place without telling you that there will be 2 more guests, how will you know that I have to make extra food for them? Tell me. You will not know, na?
Yeah.
So somebody should tell you that today there will be
Hmm.
2 extra guests, so you have to make food for them. So
Okay.
same way, when we are producing less amount of milk for our child, this pumping is like an extra demand for our brain to produce more milk. It is not for collecting the milk and feeling bad that I have only 5 ml, I have only 10 ml. Okay,
Okay.
Harini?
Hmm.
Got it?
Okay, ma'am.
Yeah.
Okay, ma'am.
Okay.
Thank you.
Welcome. Okay, girls. So it is already time. So everyone, please take very good care of yours. And I don't see any new hands raising up also. So that's good. So I hope my questions helped you a lot. Thank you so much, and take very good care of you and your babies. And if you are all connected to me, Please keep sharing your babies' pics. I love watching your babies. This time will not come back. I am telling you by my experience. When my kids were growing up, I was like you all, worried every time, worried every time. But now when my kids have grown up, I love watching small kids. I know it would be like you people would be thinking, हाँ आपके बच्चे बड़े हो गए, आप बोल सकते हो. I can say that, but I tell you, this time is the best time. Please take a lot of pics of your babies. Just watch them. They are beautiful, beautiful creations of God. And appreciate their presence in your life. This is the most, you have been waiting for 9 months for them. Now when they are in your life, just hold them and just enjoy them. Hold them and breathe them. You will see, you will feel so good, and it is like a meditation when you hold them. When you watch them when they are sleeping. When they are sleeping, just hold them and you will definitely feel awesome about it. I am in love with small babies, and that's why I want them to have the best nutrition of their mother's breast milk. So please, girls, make sure that you are giving breast milk to your baby as much as you can. Okay? So have take very good care of yours, and see you all soon. Maybe connecting on one-on-one sessions. That will be the best part. So take care, everyone. Very good night, and sleep well. Take very good care of yours. Bye-bye.